Hello everyone, today we will talk about concerns around using weight loss injections.
Hello everyone, welcome to our channel The Streetwise Chemist. Please like and subscribe.
Yes. So what are the things that no one tells you until you've taken them?
I tell them. So don't worry about that. I tell the people. The main thing that we're scared of is the swelling of your pancreas. That's a serious condition. You will know about it. Yeah. If you have pancreatitis, you will know about it. Yeah. Okay. Vomiting, nausea, pain, tenderness of the abdomen. Yeah. Probably even pain where the pancreas is itself. Yes. Diarrhea. It's a serious condition. When you have it, you will know about it. Yeah. So and I always tell my patients to say, make sure your doctors know as well. Yeah. Doctors must know that you are on this. We try to write to the doctors as well, so that they know about it. But that's the major thing that we think. We don't know how it's caused. We know that those puff daddy enzymes, yeah, there is is it PDD, whatever you call it, DPP4 enzymes. There is a group of drugs which are designed to inhibit them, to stop those enzymes from cutting down your incretins. They are associated as well with pancreatitis. Yeah, like your sitagliptins, allogliptin, whatever's. Yes, they are associated with pancreatitis as well. We don't know the mechanism, but they are more associated with it than actually the incretins. And we've had sort of inconclusive research to actually link incretins with pancreatitis, but because we had not used it much, what we call post-marketing surveillance. So as more and more people use it, we will know more whether there is a direct link to this and how bad and the percentages of it. But at the moment, it's a risk that people have to take, and hopefully it's just an acute pancreatitis that you will recover after using it. The other one side effect that I always make people aware of is the loss of thirst sensation. Yes, that it could suppress your feeling of thirstiness as well. Of thirst. So you need to drink loads and just tell yourself, I have to drink. Otherwise, this would explain why some people say, oh, I've been having a headache. So, have you been drinking loads? Constipation. Have you been drinking loads? And those are some of the things.
That's one thing I was going to mention. So obviously, if this is delaying what's going on in your stomach, could that lead to you becoming constipated?
Yes, it could. In fact, you mentioned that, and I've just remembered something. The biliary duct. So you can end up as well. There is a slight association with the gallbladder or gallstones, gallbladder problems. It's because again it stems from the slowing down of the stomach and gastric slowing down that biliary tract as well. So there is a chance that you could have gallstones, and the gallstones in themselves can then trigger the pancreatitis. Yes. So there is a link there. But like I said, until many people have that, generally it's not been a big problem. These things have come not with many side effects. Yeah, generally. I know it's difficult though with my patients, because you ask them any side effects, they don't want to stop the injections, so they'll say no, nothing, I'm good.
Because
so there's that as well.
It's changing a lot of people's lives, isn't it?
Yes. Talking about side effects, actually, I've got a lady, and I wish I could bring her onto the platform, onto the channel. She says since she's taken these incretins, her IBS has disappeared. Irritable bowel syndrome, she doesn't have it. The constipation, the diarrhea that she used to have, she says, Abes, I don't get that anymore. And for anything, never mind the loss of the weight loss. What it has done for me, for my IBS, is tremendous.
Wow.
So that's actually a side effect, if you want to call it.
But
that has become a desired side effect.
Yeah, desired,
There you are. So, but remember, the streetwise chemist is not saying get on Mounjaro to treat your IBS. I think we have to be clever there. These are anecdotes. These are things that we hear about that happen to people. It doesn't mean it will happen to everybody. So I just thought I would make that clear so someone doesn't come and chase me about for that. Okay.
So do you think that is because of the injections or the weight loss clinic kind of thing, or is it due to what she's not eating anymore?
Good question. I don't know. I never thought about it
like
that way.
Yeah.
That's actually very good. I don't know. I was just primarily thinking that it's due to the effect of the incretins on the gut motility.
Okay.
That gut motility has just happened to solve the problem.
Yeah.
Yes. One can argue it might be as well related to the food, that she is not eating as much as she used to eat. The portions have become smaller.
Yeah.
Do we have evidence to say portion sizes affect IBS or make it worse? I don't know that. But yeah, it was just an interesting one to say. Yeah, in fact, she says as well her psoriasis as well. I'm like, I don't know how that could work.
Wow.
The psoriasis have improved as well.
Yeah.
So I don't know. But the IBS, I can sort of work that on out.
But
the
skin
psoriasis as well,
can
I
be
don't know.
affected by diet as well, can't
They are. Yes, it could be that. So there are other effects that we're seeing that you would not ordinarily, think they would happen. Did I answer the question?
You did, because we're speaking about side effects,
right?
And then you're telling me, the desired effects that have come from it.
Yes.
So another one that I've seen is a lot of women, a lot of ladies have been more fertile. They've been able to fall pregnant a lot easier.
That's obvious.
Because they're losing the weight.
Yes.
So,
in fact, some weight clinics, they will tell you, I've got one of my patients was supposed to go for IVF, but they were supposed to lose
so much
to
weight
get to a certain body mass index.
Yes.
Yeah, sorry, cut you off there.
It's okay.
I jump in, I get excited. I'm sorry. Yeah, fire away.
So, I think it sounds amazing, but can this be, so if I wanted to, I've seen a lot of people say, well, they shouldn't turn to the weight loss injections, they should just go and exercise, or they should just eat less. It's not always as easy as that, but if I wanted to eat loads of cake, let's say, and then just use a weight loss injection on top of that, what's wrong with that? Can I do that? Why not?
This somewhat controversial, but I tell you, when the prices of these incretin analogs, incretin copycats, goes lower, the NHS is going to put anyone who is above 30 on them.
BMI.
Because the benefits are
30 BMI or age?
30 BMI, sorry.
Okay.
I'm thinking, you know what I want to say.
Thanks. Coming up and
it's good you're here to correct me. Yes, but I tell you, anyone with BMI, by the way, is a measure
of the height and the
of
weight.
how much weight is packed in the frame. Okay.
So over 30, is it 29 you're overweight?
Yeah, 25 is supposed to be okay. But I always tell my patients, for most women, they're in their 40s, even 35, and I tell them, 25, come on guys, you've had, one or two babies. It's not going to be possible. I usually go just under 30.
Yeah, there's been arguments over BMI, whether it's inaccurate, because if someone's carrying a lot of muscle, that's not fat, but their BMI will be higher because they're carrying more
Our Southern African women, they could have, that shape, and you think, come on, what is she going to lose? The time is not there. In fact, what is more important sometimes is the waist measurement.
Yes.
So the waist, if it's slim, and of course you can go bomb there, fine. But if you've got a big tummy, then that's the shape that we don't want.
Yeah.
But BMI per se, I'm thinking, I tell them, under 30, we're good. If we manage anything less than that, then that's good. Do I even remember the question?
Do I? We've moved on. So the question was, what's stopping me? Like, should I go and exercise to lose weight, or can I just live the lifestyle that I want and then just inject and it all goes away?
Yes. So like I said, this is controversial, but I tell you, anyone, the NHS should be putting people on this once the price is right.
Because
the benefits of it, the benefits are so much bigger than the cost of people getting fat and then ending up with diabetes and all those years of medication, hospitalization, amputations and stuff.
And it's not just that, but if you've got weight on you, your knees, your hips.
Yes, mobility.
It's putting a lot of pressure on your body.
Can you go out and work?
diabetic retinopathy.
Yes.
There's a lot that comes with being
she's
overweight.
educated, man. Wow. Yes, yeah.
So, you know, because there's a lot that comes
the
with
nurse
it.
training is coming out.
Yes.
Yeah. Okay. So yes. So I don't even want to answer your question because you must have a life.
Yes. Okay.
You
Yeah.
know, you must have a life. So people tell me when they get on this, do I need to eat this and whatever? As long as you're that balanced diet that we learned in primary school, stick to that. Otherwise, everything else, these drugs control it. You're not going to eat loads. You feel full.
Yeah, you can't. Okay,
Yeah.
so I can't eat loads of cake even
You
if I
feel
wanted to.
full. Yeah, yes,
If I was
yeah.
to take
If
it,
you
I
wanted
can't.
it, you can't have it anyway.
Okay.
Yeah, because these incretins work. They suppress your appetite and they make you full earlier. So you're satisfied before you should be satisfied. Yeah. So eat whatever you like as long as it is balanced diet. And you still lose weight anyway.
Okay, so that's
This is why the celebrities latched onto this early. They saw this and said, "Oh, what? I don't have to run."
Yeah, I don't have to. Yeah.
But I tell people as well, run, do your exercise.
Yes. So you don't just pay for the convenience.
No.
Have a
Because,
healthy life.
like I say, I think you're going to ask me about the end point or whatever. But we know they had drugs being used, whatever. Want to
Yes.
ask?
Thank you
because-
for watching our videos. For more videos, please subscribe and like our channel, The Streetwise Chemist.